Now, using our 3 steps, let's break this down. This question is asking for interventions to consider for the key problem, this potassium that is through the roof, 6.5. Then we're giving sodium zirconium cyclosilicate. Whew. So the biggest thing that I'm thinking about is that high potassium, 6.5. Normal is between 3.5 to 5.0. And for the NCLEX, we say that P for potassium is P for priority, since it pumps the muscles, and the heart's a muscle, so it pumps the heart. Now, this medication can cause edema and abdominal distension, since it's going from the body, taking all that potassium and dumping it into the body. So the solution we're looking for are actions to do before giving the med. So option number 1 is correct. The medication can cause abdominal distension here. Now, option 2 is incorrect. The medication can drop potassium, but it may work too well and cause this rebound effect. So the patient may need potassium foods. Now, option 3 and 4 are both correct here. The med can cause edema, and option 4, the med takes time to work, and it's not really used in emergency use. Now, option 5 is incorrect, because the med can technically be given even if the patient is non-ambulatory, or basically bedridden. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question is asking for incorrect patient statements regarding the key problem, tolterodine. So, tolterodine we are giving for an overactive bladder. It's technically an anticholinergic. So remember, anticholinergic dries the body. So you can't see, you can't pee, you can't spit, and you can't poop. You get the idea. So we're looking for urinary retention here. And we avoid sun exposure or even heat exposure. So the solution we're looking for are remarks made by the patient that are incorrect. So we're looking for the wrong options here. So option number 1 is correct here because we avoid heat intolerance. Remember, we're looking for the wrong options. So we have to choose option number 1. Now option 2, 3, and 4 we can't choose because the med can cause constipation. Remember, can't see, can't spit, can't poop. And the med can cause flushing. So option 4, the med can cause dry mouth, because the whole body's dry, as well as option 5 is incorrect. The med can cause drowsiness, so cautious with operating vehicles. So the only correct option here is option number 1. Okay, that wraps it up. For more detail, now using our 3 steps, let's break this down. This question is asking which confirmation laboratory for the key problem, all the labs are screwed up. So the biggest lab is 6.5 potassium. We're trying to evaluate if sodium polycistrine sulfonate is working. So if we're looking at the options, we're thinking medication effectiveness for polycistrine sulfonate. The brand name here is K-exolate. So it helps the K, potassium, to exit the body. Now, even if you didn't know that here, we're really looking at the key word of 6.5, that's high for potassium. So just remember, on the NCLEX, P for potassium is P for priority since it pumps the heart. So if you're given a list of laboratory values, really look for the potassium and see if it's high or low. So in this case, it's high. So the solution we're looking for is the lab that indicates potassium is getting corrected for polycistrine sulfonate. So option 1 and 2 are incorrect. The BUN decreased, guys, that's not the purpose of the medication. Neither is the creatinine. Those are both kidney labs. So option 3, potassium decreasing is the purpose of the med. And option 4, sodium's the same, but guys, it's not the purpose of the med. Polycistrine sulfonate, K-exolate is the brand, helps the K to exit the body. So option 3, potassium coming down, is the entire point. So option 3 is the most correct. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our three steps, let's break this down. This question is asking for priority nursing interventions or actions of what to do now for the key problem, patient with anemia that's scheduled to get erythropoietin as well as ferric gluconate for low H&H and high blood pressure. So before looking at the options, we're thinking this patient, we need to increase the H&H for more blood volume, as well as this more blood volume will add more pressure. So we have a big risk for increasing for hypertension. So the solution we're looking for is what will harm this patient? And really the biggest thing is this higher blood pressure. So option number one is incorrect here because rotating site is important, but it's not really priority here. Now, option number two is also incorrect. Assessing the patient for fluid volume status, yes, it's important, but it's not the priority. Now, option number three is the most correct because erythropoietin can cause hypertension and the blood pressure is already high. So you really have to ask yourself, what's going to kill this patient the fastest? And it's hypertension crisis, which will lead to heart attack as well as stroke. And lastly, option number four is incorrect. So iron is, guys, there's no data, that's not even needed. So option number three is the most correct because it's the most harmful for the patient. Okay, that wraps it up. Now, using our three steps, let's break this down. This question is asking which explanations for the key problem do we use sodium polycisterine? So the brand name here is K-exalate. So before looking at the options, we know that polycisterine we give to decrease the potassium. So K-exalate helps the K, the potassium, to exit the body and into the body. So the solution we're looking for are correct purposes of this med. And really the only correct purpose is to lower this potassium via the intestinal route here. So option number one is the most correct because it lowers potassium via the intestinal route. So from the body into the potty here. Now option two was really close, but it's not always used in emergencies since the bowels act very slow. So remember, high potassium emergencies, we use calcium gluconate to glue down the excited muscles since potassium pumps the muscles. And we also use insulin, which pushes potassium and sugar into the cell out of the bloodstream. So again, polycisterine is not used for really acute or emergency settings. And option three is incorrect because it doesn't trigger blood levels. And option four and five, guys, not a cleaning enema. It's used to decrease this high potassium here. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our three steps, let's break this down. This question is asking what to report for the key problem, patient taking oxybutynin. So before you're looking at the options, we're thinking we're giving oxybutynin, the O's and the B's, for overactive bladder, the O and the B. So it's an antispasmodic, and the major adverse effect is urinary retention. So we're giving it to treat that overactive bladder, but it might work too well and cause too much urinary retention. So the solution we're looking for are findings that can indicate the problem with the medication. So option one and two are incorrect. Increased sleep and cognition is good, guys. And option two, increased energy is good as well. The big thing we're looking for is option three. So no urination at all at the whole day, guys, that's big time urinary retention. So that's the biggest thing that's not good. Now, option 4, 5, and 6 are all okay. So, controlled constipation is good. Heating pad for joint pain, that's appropriate. And saline drops for the eyes, that's okay because this thing will make the body dry here. So, the biggest thing with oxybutynin is looking for urinary retention for overactive bladder. Okay, that wraps it up. For more details